My topic is ultrasonography of the fetal brain. It's about normal and abnormal findings. I'm Qingqing from Beijing OBGYN Hospital. This year, ISWOGO published a new guideline about the fetal central nervous system. The part one is the performance of the screening examination. Central nervous system malformations are some of the most common congenital abnormalities. Neural tube defects are the most frequent seeing eyes malformations and amount to about 1 to 2 cases per 1,000 births. The incidence of intracranial abnormalities with intact neural tube is uncertain, and most of these new abnormalities probably go undetected at birth and manufactured only in late life. So the screening evaluation of the fetal brain to be performed as part of the mid-trimester anomaly scan, which is referred of this document and the screening examination. So how to screening examination for normal and abnormal. Structures usually noted on screening ultrasound examination, including head shape, lateral ventricles, cavernous empty porosity, centimeter, cerebellum, cistern magnum, and include all the contents. Usually use 3 important planes. Evaluation of the 2 axial planes relevant cerebral structures to assess the anatomic integrity of the fetal brain. Usually transventricular and the transcerebellar planes. And the third one is so-called transthalamic plane is frequently ended. So the 3 planes is very important. Structures that should be noted in routine examination, including the lateral ventricles and the cerebellar, cistern magna, and the CSP here, and the hand shape and the brain texture should also be noted on these views. So in the 3 planes, the first we should noted the integrity. Integrity is the intactness of the scrotum. The second is observation bone density. Bone density, we can see poor visualization of the near field. The third one is FOX. FOX is usually interrupted by CSP, the FOX 3. And 4 is the posterior half of a lower lateral ventricle is here. The 5 number is to show the front half of both lateral ventricles. So it's very important to observe. Firstly, we look the hand shape. We should including size, shape, integrity, and density. We can use the smart plane of the 3 planes. It's very quickly to guide the planes. Smart plane is a measures inclusive technology for fetal CNS study, self-treated with artificial intelligence, including 5,000 cases. 4 CNS planes and 6 measurements, we can accurately detect and quickly guide it. Let's look at the video. It's a smart play. First step, we can acquire a 3D fetal head data set from BPD view, this BPD view. And step 2, BPD view. And step 2, press the smart planes tab on the touch panel. Step 3, detect and display the TCP, TTP, MSP, TVP automatically. Here, it's very quickly. The step 4, press the automate button on the touch panel, and the system will automatically measure the here, the BPD, OFD, HC, TCD here, and CM and LVW. So very quickly, let's click again. Look at the pictures. So very quickly, first steps very quickly to get to the plans and get to the measurement. Yes, automatically. Here, the 6 measurements here is very quickly automatically. It's easy to use. Yeah, the TCP, TTP, MSP, TVP, we can get the value here very easily. Yeah, these 6 measurements here automatically to get the measurements. So how about the size? We look at shape. Firstly, we should to measurement the size. How to measurement? We should put the dot out to inner for BPD and HC for the circle. We just use a smart play. It's very easy to get BPD, OFD, and HC here. If the HC is lower, below the 5th centile, the microcephaly or spina bifida. So which one we should think about? So this plane is a transthalamic. We can see the midline forks, CSP here, both thalami in opposition and separated by forks. This one is a hippocampal gyri here. And here is later sulcus. It's transthalamic plane. This plane is transventricular plane. Caliper is out to inner. This is standard. Angle of inclination 19 degree to midline ankles. We can get the pictures and should know symmetric hemisphere half and the midline here. Fox with CSP and thalamus. Cerebellar should not be visualized. Look at the left pictures, it's BPD, OFD, and right pictures for HC. If the CI is normal, we can calculate it by BPD and OFD, the ratio. The normal value is 75 to 85. If below 75, for the hand, it's dolichocephaly. If larger than 85, for the hand shape is brachiocephaly. School thickness at 20 weeks, usually 3 millimeter, equivalent to 3 days of gestation, so 3 millimeter about. The sector to the image is to observe the shape. The shape is very important. The school normally has an oval shape without a focus protrusion or defects. This smart plane, we can see it's normal score. Normal. Yeah, it's iPage pictures. The oval shape. But for this one is a lemon, strawberry here. Club leaf here. So what's this one? What's this one? Like club leaf or not? This craniosynostosis. Look at the sutures. closed for the sutures here. So we should know the shape for the hand. Dolicho carefully, branch carefully, strawberry, cleft leaf. The third one, we should observe the integrity. The integrity is no bony defects should be present. Like this, it's normal. Scroll, it's normal. It's eye page from smart plane. But for this one, in careful seal here, the green meningocephaly here, because the brain tissue can extrude through defects on the front of occipital bones. Also may occur at other sites as well, but usually in hospital, in hospital. Look at the cases pictures. This one is in careful seal, and you can see the brain tissues extrude through the defects here and also here. The third one, we should, for the head shape, we should observe the density. So normal score, the density is manifested as a continuous anchogenic structure, like this picture, very clear, and it's normal score. And normally, it can be interrupted only by cranial suture here. But how about this one, and this one? It's normal or abnormal? The three pictures is poor mineralization of the skull. Reduce the bone density. Look the hand, the bone. Yeah, reduce the bone density. This osteogenesis imperfecta. For this one, the absence of this whiteness or extremely variability of the fetal brain should raise suspicion of the poor mineralization. Also, if poor mineralization is also suggested when the skull becomes easily depressed. We use transducer press the head very easily and place transducer place against the maternal abnormal wall. So the hand of the skull easily depressed. Now, let's look at the later ventricles. This is smart play. We can see EPG pictures. You can see the transventricular plane. We should assess and documented the atrium distal to the transducer and the presence of CSP here. Transventricular plane, anterior and the posterior portions of the lateral ventricle here. So the atrium is characterized by presence to the glomerulus of the choroidal plex here, which is highly anchogenic. And the occipital horn is filled with cerebrospinal fluid here. It's CSP, but in close contact with the medial and lateral walls under normal conditions. In some normal cases, small amount of fluid may be present between the mid wall and the choroidal plex here, fluid here. To measurement the lateral ventricular, the criteria is very important. this recreate well how to measurement. A professor gave an image screening method from Guibald professor. Primary criteria is 1, 2, 3, and the secondary criteria is 4, 5. They give the score 0 to 2, 0 to 1, 0 to 1, 0 to 2, 0 to 1. Its important requirements is for midline structures equidistant from proximal and dismal margins. Yeah, it's equidistance. And midline perpendicular to ultrasound beam. And the cavum center pilosity or focus columns here. And V-shaped fluid field triangle here. Measurement, the lateral ventricle should opposite the internal here, internal parietal occipital sulcus here. And the on-to-on measurement. And the transventricular plane axial occupying the whole screening with visualizing both proximal and distal margins. And due to artifact in the near field of the image caused by shattering from the proximal parietal bone, in the standard transventricular plane, only a hemisphere and a lateral ventricle on the far side of the transducer are usually visualized clearly. But most severe cerebellar lesions are bilateral or associated with a significant deviation or distortion of the midline echo. In screening examination, symmetry of the brain can be assumed. Look the two cases. The A is normal and B is transom 13. BPD is the same, 24 millimeter. So to measurement is very important. Also, ventriculomegaly is associated with genetic anomaly, trisomy 21, trisomy 13, and Archaic syndrome. Let's look at a case. This case is a ventriculomegaly. The vitals of lateral ventricular is measured by smart plane here. Look, LVW is 1.09 centimeter. Ventriculomegaly. 1 second, we get the smart plane and get the 6 measurements. This case is a trisomy 21. The left picture is 21 weeks. Another one is 24 weeks. It's ventriculomegaly. This another case is hydrocephalus. Hydrocephalus, and we can see clip. You can see heterogeneous echo here. Heterogeneous here, echo. Hydrocephalus. Hydrocephalus. Heterogeneous echo here. And for IP, you can see heterogeneous echo here. Yeah, this is another case, 21 weeks, choroid 6. Both sides choroid 6, both sides. smart play to guide to the eye page. Both sides colored planks very clearly to show. Both sides big. Let's look at the CSP. The CSP is fluid flow filled cavity between the two thin membranes here. In late gestation or early neonate period, this membrane is usually fused to become septal pellucidum. The CSP become visible between 17 and 20 weeks, and it disappears near term. So what's the normal value? The normal value is 2 to 9 millimeter. Also, the CSP is very important. The abnormal shape of CSP has been described as a relatively reliable marker of partial angenesis of corpus callosum. So absent cavum septal pellucidum, we also can get the pictures like teardrop ventricles. And absent CSP is ventricular megaly. Okay, let's observe the salami. The transsalami or BPD play, usually to assessment to the fetal head. Look the fox, CSP, salami, lateral ventricle, third ventricle, and the anterior or posterior ventricle. Also here, we can see hippocampal gyri here, hippocampal gyri. This case is 19 weeks. What's this show us? The single ventricle, the salami fusion, and the ocular hepatalism, and the single nostril here. The 3D pictures can see the single nostril. This video, single nostril here, single nostril. Yeah, single nostril. And the eye page, you can hollow person carefully. Single ventricle. Usually global most severe type associated anomalies with face and nose. Face and nose. Okay, look more pictures. This one is a hollow person carefully. Single ventricle, fusion salami here. And you can see what's this protrusion? Proboscis here, proboscis here, proboscis here, proboscis here, and a single orbit. Let's look at the cerebellum. The cerebellum appears as a butterfly-shaped structure. This picture is by smart plane to guide the measurement, the cerebellum here. Cerebellum formed by a round cerebellar hemisphere. The vermis in the middle, joined in the middle by more anchogenic cerebellar vermis. Before 19 to 20 gestation weeks, the cerebellum vermis had not yet completely covered the first ventricle, and this usually appears may give a false impression of a defect of the vermis. So we should care for the vomits. Avoid over-tightening of the probe, since this will increase the likelihood of false positive diagnosis. So we should care for false impression here. So look cerebellum, it's cerebellum plane. In the correct plane to measure the maximum diameter here. If TCD below the 5th centile for period of vegetation, cerebellar hemisphere appear separated. Look, transcerebellar plane. Look the vermis defect here. This standing workers malformation. And also transcerebellar plane, we can get the cystic hygroma. Look, this one, this sector here. This another case, Icadi. Banana, look, banana, cerebellar banana, like shape of cerebellar banana. Ventriculomegaly here. Club foot, spine bifid here. This Icadi syndrome. The last one, let's see the cisterna magna. The cisterna magna is the fluid here, posterior to the cerebellum here. Fluid-filled space here. It normally contains thin septations, very thin septations here, which is not usually demonstrated in the prior pathology. It's normal here. It's normal. The septa is normal. In second half of gestation, the anterior posterior diameter of the cisterna magna remains stable, should be not exceed 10 millimeter. The CM, the normal value is below the 10 millimeter here. Not exceed 10 millimeter. Cisterna magna to measure outer edge of vermis to inner edge of the occipital bone here. Outer edge, inner edge, normally is 2 to 10 millimeter. So use Mary's smart plane, we can easily get the 3 important planes and get 6 measurements value very quickly and easy. This case is 32 weeks. It's diagnosis as standing worker syndrome in 2D, but the corrected diagnosis from smart plane is just a large cisterna magna. You can see the vermis, it's normal. This case is the large posterior fossa. This eye page, we can see, yeah, the large posterior fossa, and can quickly get to the 6 measurements value. So the 3 planes is very important: transventricular plane, transthalamic plane, transcerebellar plane. For the hand, we should observe the shape, integrity, and the measurement. Because the 3 planes, we can find anomal appearances, many anomal appearances. A lobe hollow parent carefully, banana-shaped cerebellum, cystic hygroma, large posterior fossa cyst, lemon-shaped skull, occipital encephalocele, and skin edema, and ventricular megaly, and blah, blah, blah. So it's very important for the three plans, transventricular, transcellular, transcerebellar. These three plans, transventricular, transcellular, transcerebellar. But if we get the appearance of abnormal for the hand, we should to do the targeted fetal neurosonography. So these indications for targeted fetal neurosonography and for centered place and the current place. So to do detailed information. Okay, thank you very much.